Know what causes that tooth cavity, that hole you have on your tooth that can result into removing your tooth or some of your teeth. Tooth cavity can result from a lot of problem. And when it's not detected early, if you don't know it in time, it cannot be reversed. You don't have option that to get your tooth removed. And if another care is not taken after removing it, it could still infect the other. They say prevention is better than cure. So if you know the cause, you can easily prevent it. So I'll be giving you four causes of tooth cavity so that you can take preventive measure. Number one cause of tooth cavity is poor oral hygiene. If you are not brushing regularly, if you are not flossing regularly, and if you're not getting your teeth checked regularly, it will result into build-up of particles and could result into cavity and other teeth problem. So brush twice a day, floss at least once a day with your floss or your toothpick. But better choice is floss. It's more friendly to your enamel and your gum. And visit your dentist every 3 months. Second cause is the consumption of sugary food or acidic food. When you take a lot on especially bite from chocolate, from cough syrup that are very rich in sugar, it can result into build up of bacteria, and this bacteria will result into build up of plaque, cavity, and bleeding of gum and enamel. It will erode the enamel as well. The third one is dry mouth. This is especially common to smokers. When you smoke, when you have dry mouth, the mouth becomes so dry that you don't have enough of saliva to neutralize the acid that is produced in the mouth. So your mouth or your set of teeth become a breeding ground for bacteria and result into buildup of cavity. So you become vulnerable. Finally is irregular checkup. On a regular basis, you're supposed to be checking with your dentist every 3 months, especially if you have symptoms that you can't explain, so that you can detect it early. Cavity, when detected early, you can reverse it with some medication. But if you don't detect it early, medication will just give you temporary relief. That is why if you take medication, you'll be like, "Ah, I took this medication after a few months. Now it's back. The pain is back again." That is it, because that means it's not reversible. You have to see your dentist for something to be done to it permanently. So now that you know the causes, you can take preventive measures by avoiding smoking, cut down on acid and sugary food, and optimize or upgrade your oral hygiene. And make sure you check with your dentist every 3 months.